Hello everyone, I'm back again. I do apologize, I'm not very good with Facebook Lives because I can't see the audience in front of me and all I can see is my own camera and face. So just bear with me. So today we're going to talk about acne, but before we start, I want to share a few things. First of all, thank you so much for all those who actually waited patiently about the acne live video. And I do apologize that I was meant to do this live from the Skinzo Open event, but the day was jam-packed and I couldn't manage to do it. So I do apologize for that. And that's why I'm doing it live now. The second thing is that if you have not already signed up for the Skinzo newsletter, it's free to sign up. Then please do that. Either you can send a message just on the Skinzo site or website, or you can send an email to info@skinzo.co.uk. What is newsletter? We are going to focus on skin education. So I'm going to pick one topic every month. So this month, the month of March, the topic will be acne. So I will be talking a lot about acne, and you can get the newsletter, read about it. Any questions, you can always send me a message. That's one thing. Second thing, it's similar to skin blogs I'm planning to start because many people, they have asked me lots of questions about other skin conditions. So we can do that as well. If there is any specific thing you want to talk about, send a message. Now, what else? So that's it. The first newsletter is coming in end of March. And there's another event coming up, live event. So just stay tuned. I will be posting about that. So let's talk about acne. Let me just see, somebody has joined. Let me send some invitation. Okay, somehow or other I can't send invitations to my own friends. Anyways, so what is acne? Let's talk about the overview of acne. Acne is a very common skin condition. It affects what we call a pilosebaceous units. Now, pilosebaceous units, in simple words, it means hair follicles and sebaceous glands. Sebaceous glands are oil-producing glands. Oil, as a medical term, we call sebum. So it's one and the same thing. Now, oil-producing glands are present everywhere on the body, but they're more present on face, shoulders, neck, upper parts, and that's why usually acne is more common on these areas. Now, it's males and females, they can have it. Usually it's more common in females. Any age group can get it, but again, it's 85%. It's more common in young adults. It's common in between the age of 11 to 24. About 3% adults, they can have acne. It has been reported above 30 years of age. So it's not true that acne has to start from teen, which means 13. Basically, people can have acne from puberty. That's why sometimes I've seen patients with turning 9 or even 10 as well. They still can have that. The other thing is that all skin types can have acne, but certain skin types, darker skin or black skin people, they have more risk of acne because the skin is very oily. So the more, so genetically, if you have a dark color skin, your body is producing more oil, and that's why the skin conditions get worse. It's also reported common in white Americans, Afro-Caribbeans as well. There is a family history, usually people can have, but it's not, too much linked with it. What else? So the types of acne was the second thing. The different types of acne. Acne rosacea to acne vulgaris. Teenage acne is usually acne vulgaris. Acne excoriae is another type of acne. We can talk about the rest types differently. So today I'm focusing on acne vulgaris or the teenage acnes. These other things, people have asked me what exactly happens in acne. What how they can help to prevent. Okay, so I'm just going to explain a little bit what happens, how these pilosebaceous units, they behave in normal skin, and then what exactly happens in people with acne. So so imagine that this is the skin, which is the surface, which we can see through the naked eye, and everything, especially the oil glands, are present in the second layer of the skin, in a little bit of a deep. So in a normal skin, this is like an oil gland which is present there, and the function of this gland is to produce oil. Now, when it is producing oil, oil is important for skin because it acts as a barrier. It helps with the barrier function of the skin, with the protection of the skin. So, and it helps to keep the skin hydrated. So normally the oil is produced through the oil gland, and it has to come to the surface of the skin through a small duct or a tube, or you call it a hair follicle. Now, when it's coming, naturally, whatever the skin needs, skin absorb, and the rest oil, its skin kind of get rid of it. That's the normal process in somebody who does not suffer with acne, maybe like me. But people who suffers with acne, what happens is that because of certain conditions, intrinsic or extrinsic, which simply means certain conditions of your own body, which you perhaps cannot control, like hormones, not genetic, but sometimes yes, in few races, which is common, you cannot control. That skin type you cannot control. It can affect the way the oil gland behaves. And it starts firing at a very high speed. So I will explain how you get a pimple, or how then when that happens, how exactly that gives you like a breakout. So that's all the things inside, and then the factors outside. So for example, sun exposure. If you're going out and you're not using an SPF, which is a sun protector, it causes damage to the skin, and then the natural pathophysiology of the skin changes. So naturally, how the glands they behave, that changes. At the same time, if you have any active skin conditions, or you have a sensitive skin, or you don't look after your skin and your skin is not very strong, that can then affect that. Other factors like certain medications, for example, antibiotics, especially tetracycline, which we use to prevent acne, but it also puts you in a category where you're at high risk and more vulnerable to have a sun damage or a photosensitive rash. So that also actually makes it worse. Then other conditions, certain other medications, contraceptive pills, they're not acne friendly. Certain pills can give you a breakout. Hormones at puberty or pregnancy, breastfeeding, or if you're going through a really stressful time, or your diet is not good. So for example, fast food takeaways, they are not very healthy. If your skin is dehydrated, people who don't focus a lot on water, or a lot of sugar products in your diet, and also omega-6 fatty foods, they increases the production of oil. At the same time, certain other conditions like smoking, which delays the wound healing, and it delays everything. So that can have a knock-on effect on how not the acne gland, but how the oil gland behaves. Okay, so now imagine all of these conditions are there, and this is again your normal skin, and that's the oil gland which is sitting there. Now this gland is then firing at a very high speed. Okay, so oil is producing. Now this oil, because the skin is struggling to get rid of the excessive oil which is not wanted, so all of that is stayed behind, and that blocks the tube which takes the oil from the oil gland to the skin surface. So if the tube is blocked, oil is the best medium for a bacteria called the acne bacteria, which is a normal bacteria for the skin, and it is present, in every person. It does not misbehaves. It actually usually behaves. So in this situation, it starts misbehaving, and it multiplies faster. So when it multiplies faster, it becomes inflamed. The gland becomes inflamed, and when the gland is inflamed, it started swelling up. And if you see, this is the surface and this is the gland, it's swelling up, it's kind of pushing, and you see a pimple coming. That's the easiest way to explain. So when the gland is inflamed, when I was a medical student, I tried to remember what exactly happens when something is inflamed. So I kind of focused on flame from the inflammation. So flame is like, really hot. So people can feel heat coming out under the skin. They feel bump present under the skin. Pain. So if you touch a flame, it's painful. So it can cause redness. And that's why skin becomes really red, multiple spotty areas. So redness, pain, burning, heat. And then if the inflammation is there for a long time, it's given all the right things, opportunity for the acne bacteria to stay, misbehave, and it becomes infected. Once it's infected, then it can cause scarring. So it's a process rather than just a step. So this is how people, this is what acne is. This is how, this is exactly what happens under your skin. So if you can visualize what I've kind of literally explained, then you can actually do many things to, which can prevent these spots to happen. We'll focus on that. I'll come back on this in a bit of a second. So there was another question that the different types of pores when people get. So I'll come to that again. One thing before I answer this question is, so if you see that this is the oil gland and this is the surface. So next to the oil gland is a hair gland. Okay. So hair gland, again, the hair comes through the hair follicle, and that is literally, it has to come to the surface. That's how it's coming. So this oil gland is present next to it, and it shares the hair follicle. So as a result, when this is inflamed and angry, it put pressure onto the hair follicle as well, and hair follicles can get inflamed. So I actually see many patients with they can have a condition called folliculitis, which simply means inflammation of the hair follicles, because they have a background acne. So they do work together. So it's really important. So especially for males, if you are shaving, if you are using a clipper, you need to be very careful, because it's important to know when you're shaving what angle you're cutting, or you're taking off the hair, or what type of razor or what type of blade you're using. Is it causing damage to the area around it as well? So if you have an active acne spot next to the beard area and you're shaving, are you actually removing the skin from the active infected or inflamed spot? So you are then at a risk of spreading that to the other parts. Okay, so it's not contagious, but you are facilitating the infection to spread. So that's how infection spreads. So you need to be very, very careful. One way, if it gets really bad, one way you can avoid it is try and not to shave like too much. I know it's not, it's easy for me to say it, but maybe if it's a really bad breakout of acne, maybe just shave it when it's necessary. It does help. Okay, so then the question was, what is blackhead? What is the blue head? Not the blue head. What is the blackhead and what is the white head and all of that? Okay, so now a simple rule. Something we called comedone. So comedone is just a plug. It's just a plugged hair follicle. Okay, so it's just a hair follicle which is clogged up. That's all what it is. Now the white head and the black head, easy to remember. So the white head is like a bumpy white kind of these spots which you feel just under the skin. So what is happening is, this is just the clogged up of the hair follicle because of the oil gland, okay, or because of an inflammation in the hair follicle. Either can do that, and either can give you a whitehead. But whitehead is not obvious. It hasn't reached or opened to the top layer of the skin. When it reached and opened to the top layer of the skin, it becomes a blackhead. Why it becomes a blackhead? Because it's the hair color, which because of the light, it changes the color of the sebum, which is the oil. And that's why you see the black in that. So that's exactly what it is. There's nothing more to it. So there was another question somebody has asked, that can they so if somebody has got more whitehead and a blackhead, does that affect acne? Yes, it affects acne, because what's happening is that if you're not cleaning your skin, so the skin breathes. So skin is an organ. So many of my clients, when they come and see me, or my patients, I'm a big believer of skin education, or and unless you understand what's happening, you cannot cure it. So they say, well, my skin is really sensitive, and I cannot do this, I cannot do that, I can't put anything at all. Is that normal? To me, it's not normal. The reason behind that is because skin is an organ. Just like kidney, your heart, they are organs. So if I come and say, well, guess what, my heart is really sensitive, I can't do this, or do I need a treatment? Do I need to look after it? So this is exactly what skin is. So you have to be careful that skin is the biggest organ, and it's not just the face, it's everywhere on the body. So if the skin is sensitive and you just leave it, that, oh, guess what, I'm not bothered, skin will not breathe. And if skin is not breathing, and skin gets affected with any condition you can think of. So skin is just not eczema, just not psoriasis, just not acne. Skin is everything. A little stress, if you're stressed out, that can have a knock-on effect on your skin. So then, yes, it's not right. This means your skin is kind of shouting and saying, I'm sensitive, super sensitive, help me. I don't like the way you're treating me. Okay, so it's really important. What is the other thing? Okay, so I'm gonna go back into what what I was planning to tell a little bit more about the acne. Okay, so now one other thing you need to be careful, that I did mention about pregnancy, breastfeeding, and contraceptive pills. They're really important, because if you are planning to conceive, it's important what type of medications you should be on. Even that's the topical creams. Not every cream you can choose. So I'll come on to this in the treatment section. That was another question was asked, that can anybody choose any treatment? Not really. Okay, so a little bit more about does it matter that you have spots? So there's an interesting study that people who suffer with acne, is it all 100% active disease which makes them worse, or is it active and psychological factor which makes it worse? So it was very interesting to know that about 24% people who were signed up for the study, they had a psychological acne. So it's important that when you see a doctor, this was the question basically, another one, that is, my doctor does not understand my spot. So I think it's important that you need to understand what this spot is, okay, what you can do, and then you need to understand what your doctor is trying to tell you as well about the spot, okay? So yes, it's visual, skin is visual, but there are certain medications you cannot use for acne. So if the doctor is not giving you this thing, it does not mean they don't understand it. I think it's important just to kind of have a quick chat with them. Not every acne needs to be seen by a dermatologist. But yes, I totally agree. If the acne flare up are really bad, like 85% of people who suffers with acne, they actually get 2 to 3 times really bad severe acne flares up in their life. And one of the biggest risks is scarring. Once the scarring happens, already happened, then it's not much we can do. And I totally agree with that. But it does not mean that you have 1 spot or 2 spot and you think, well, this is actually going to scar, so I really have to go and see a dermatologist. I don't think so that's right, because even if you see a dermatologist, so if you're seeing me, there are certain medications you don't fit the criteria, like isotretinoin or Roaccutane, which I'm going to touch at the end, because everybody, so many people have asked about Roaccutane. They want to go onto it and they feel this is the only drug that works. That's not true. This is not for everyone as well. Okay, so I've already explained the food linked with this. What else has been left? Okay, so let's talk about what you can do. Okay, so now education is really important. as is normal skincare, what you can do at home to prevent this. Okay, so I've already explained how the oil gland is firing. So you need to understand that if the gland is there which is inflamed, inflammation can cause dryness. It does not mean your skin is extremely dry, and it does not mean that you need to put lots of oil onto it. So if you are the cause of acne is because of extra oil and you're adding more oil, it's not going to work. And this is something which I really struggle to explain to people. They're like, but no, my skin is dry. Okay, yeah, I totally understand that maybe this spot is dry or this spot is dry, or maybe generally you're having a dry area. But imagine that you have so many oil glands. So the spot which is active, maybe 1, 2, maybe 10, maybe 20. But you have other oil glands as well, which are producing oil. So naturally, because your body is producing a lot of oil, so if you're using any products, skincare products, or even face wash or scrubs, that is actually going to make it worse. So you don't need extra oil. You have to go onto oil-free products. It is really important if you really want to make your acne better. So I always say, listen, I cannot, because, okay, so let's start this way. We cannot cure acne. Acne is unfortunately one of the conditions. It's the 8th most common condition, which is rated in the world, which causes the maximum psychological effect on people. We understand that. But at the same time, acne is one of the conditions. We cannot cure it. So once we cannot cure it, we can only control the symptoms. So this means that it is like a roller coaster ride. Anything can make it worse. Stress, I can't control everyone's stress. You can't control stress. So even if you have a mild acne, if you're in a stressful situation, sitting for an exam or going through, relationship problems or social problems, or you don't have time to look after your skin, all of these things can precipitate and give you another flare-up. So that's important. Okay, so back to the normal skincare. So you have to clean your skin. It's important you wash. Either you can use a gentle cleanser. It's fine. But you have to wash it in the morning and at night. So it's not because of dirt. So it is not infectious, and it does not mean that you've kind of accumulated a lot of dirt there. So I get to see, when I see clients, they literally rub it. So they're rubbing the follicle which is inflamed and angry. That becomes worse. When they're rubbing it, they're breaking it. Once it's broken, the bacteria is kind of flooded out, and that is kind of invading the other parts. So if there is an active acne, which means the spot is really angry and inflamed, don't touch the spot. It's perfectly fine. But around it, you can just clean the face around it. That's important. Now, there's certain products available you can buy over the counter, like a benzyl peroxide is really good. It's good for acne. What it does, it's an antiseptic. It is available in gel cream forms. It's available in face wash as well. I do a lot of Xenobaji skincare. I have a lot of clients on acne, which I treat actively with Xenobaji skincare, but it does not mean you have to go and be on a medical grade skincare, but it is available. When you're going for a benzyl peroxide, few things you have to be careful, or you need to know. It can cause stinging, burning, and inflammation. When you're going out, these products can give you photosensitivity rash. So you have an inflamed area, okay? You're going out to sun exposure. So remember, from the sun, we have UVA, UVB, UVC. We can talk about it some other time. But UVB, remember, that causes burning. So already you have an inflamed area. Remember, inflammation, I've already just mentioned. It's causing burning. You're going out, UVB from the sun is attacking that area. It's causing more burning. Then you're putting benzyl peroxide. So it's 3 times. So then if you're coming back and saying, well, guess what? You've given me the wrong treatment. Not really. You can build up. You don't have to use it every day. You can use it maybe twice or 3 times a week if you want. But it's really important for you to put an SPF 50 all the time, summer or winter. Okay, so it does not mean and especially if you're going out for a holiday, when the sun is shining and you just, you know, using sunbaths and all of that, that is not going to cure it. Okay, so that's really important. It also, benzoyl peroxide also has a bleaching effect, so you need to remember that when you're putting it, it can bleach your hair, it can bleach your clothes. That's very common. So another thing is, when your skin or the spot is inflamed, whatever you put, it can cause burning and stinging. It does not mean that the product you've put on that area, you know, you've got an allergic reaction. It does not mean that. So that's one thing which is available over the counter. The other things you can try are, again, the topical retinoids your GP can give you. Tretinoins, azelaic acids, and dapaline, all of these are available. They have all the same precautions. And it is okay to try. The only thing is, even the topical retinoids, if you're going on it, is you have to be careful with pregnancy. That's really, really important. Now, other thing is, this is again, if there are medical, I can see there's some medical health professionals joining here as well. So one of the very important things is, I do see many clients where they are using a topical antibiotic cream and an oral antibiotic as well, which are totally different. They don't need it. It doesn't work that way. You're actually increasing their risk and their resistance to the antibiotics. They don't need it. So either you give them a topical antibiotic or you give them an oral antibiotic. With the oral antibiotic, usually we say 6 weeks you can have a trial of that, oxytetracycline or lamicycline or doxycycline. Doxycycline has got more anti-inflammatory effect. You can use it, but we have to be careful in children. It can cause a staining of the teeth. So any antibiotic, you shouldn't be on it for years. So I've just seen somebody has asked about a question about a cosmetic procedure, chemical peels and things, for a client who's on 5 years, I think, or 4 years on lamicycline. No, that's not right. You need to have a break from the antibiotic as well. And it's not always just a prevention. So yes, we're using the antibiotic to cure. We're leaving you on an antibiotic for a specific period of time. Then you need a break from the antibiotic. Now, all of the tetracyclines, when you're going out to sun, it can give you a photosensitivity rash as well. So you have to be mindful. People don't put... sorry, someone has sent me a message. Okay, that's fine. So people don't put sun cream at all. Okay. And they come back and they have a rash and they say, well, I've got an allergic reaction to that. No, that's not an allergic reaction. What are the other things? Okay, another very important thing you have to be careful is any occlusive cosmetic thing you're using. So anything which has got a heavy molecule or which is going to occlude the hair follicle, it's a no. You can't use it because that's going to make it worse. So for example, just a very quick example, like vitamin C is really good, but vitamin C is a huge molecule, and vitamin C can clog up your, sorry, I just need to push this, getting some messages at the same time. So vitamin C can clog up that, and if the pores are clogged up, okay, you're accelerating the process of inflammation. So then maybe this is not a good idea. That's why the medical grade skincares are important, that you have to go and see your specialist to get advice and use whatever you need. So again, any kind of cosmetic things if you're using has to be oil free. That's really important. So you can put an SPF 50 and you can apply foundation on the top. That's perfectly fine. Other thing is people who swim. Chlorine can cause a lot of stinging. And I see many clients in dermatology, when they come and after swimming, they have a really bad rash and they're like, well, the medications are wrong or whatever. So you have to be very careful. That can make it worse. Okay, so what else? Okay, another very important tip. So imagine that you have a lot of oil. Now, oil is not present only on the face, as I've mentioned, pilosebaceous units everywhere on the body. So your scalp is really important. So it's important, you need to wash your hair as well. So people come and they're like, well, I don't wash too much because the shampoo actually comes and stings my face. And you're like, okay, but the oil is dripping. Okay, so you need to be careful. That is important for you to do it. At the same time, if it's really bad, a flare-up of acne, you can you can you need to change the pillows as well, the pillow covers, because if there is a lot of if you imagine you have all the active there and you're sleeping onto that side, and you're sleeping on the pillow, the same one every day, it's like a bit of a cross contamination. So this is all in your own hands. This is nothing to do with your doctor. So please be careful with that. What else? Okay, so scrubs, yes, you can, but avoid using any scrubs which are really rough, because if I'm scrubbing that, exfoliating that area, yes, exfoliation is important. You should be doing it, but it depends what type of acne and how much your skin can tolerate. Okay, what else is, so we've touched all of these things. Cosmetics I've already, yes, okay. So another thing, somebody has asked this question about sports. So gym, sports, you need to remember, when we are kind of doing intense exercise, we are very sweaty. So when we are sweaty, we are producing more, so sweat is clogging up all the glands, okay? So same rule. So make sure after gyms and things, you need to take shower. Make sure that you're not in the same process. That's all is really helpful, okay? Now, other medications, so antibiotics, yes, that's perfectly fine. You can go and be on antibiotics. If 6 weeks, 8 weeks, it's not helping, then yes, go and see your doctor. In terms of isotretinoin, now the government medicine regulating society, regulating agency has very clear guidelines about isotretinoin. I think we can talk about it in detail later on, but it is only to be prescribed by a dermatologist. Because their specialized blood test needs to be done. It's teratogenic. This means that it can affect the unborn baby, so people cannot get pregnant on it, and after stopping it they have to wait 2 months as well. So there are multiple things linked with it. It can have a knock-on effect on mental health, and it does not work on scarring. So the other thing is that your doctor is not referring you to see a dermatologist for the scars. Unfortunately, there is nothing much available on NHS which we can do for scarring either. So isotretinoin, yes, it helps with really severe acne breakouts. You have to be on it according to your weight. So it's not a medication a beautician or another doctor or a cosmetologist can give you. It has to be a dermatologist who needs to prescribe it for you. And it can and there is you can't go back onto it very soon once you're finished. So 6 months usually is what we recommend. Sometimes a clinician can go a little bit longer. So you need to be careful with that. It does not take away the scarring. So I see many clients that are being referred and they think that isotretinoin is going to take away the scarring. Not really, actually. So then there are other things available outside NHS in cosmetic things, microneedling and chemical peels and medical grade skincare, which is available, and you can use that. I think I've literally explained whatever was actually asked. So I think this is enough for today. Thank you so much for watching. And if you have any other questions, okay, sorry, one last thing was somebody has asked about the protein shakes. Okay, so protein powders, they can clog up your oil glands, and oral steroids as well. So anybody who is into bodybuilding, if you're using steroid based products or milkshake or shakes and things, protein powder shakes, it's not good for acne. I think I've covered now. There's no further questions left. So we can talk about purely medications, antibiotics and isotretinoin, and then we can talk about cosmetic procedures available in the next one. In the meantime, if you have any questions, feel free and send me a message. Thank you so much for your time, and thank you so much for watching. I hope you all have a very good evening. I'll see you later. Thank you. Bye-bye.